Gestational diabetes is diagnosed based off of an oral glucose tolerance test. This test is not a test to see how great you're doing throughout your pregnancy. It's not an indicator of anything that you have done wrong because gestational diabetes can develop in any pregnancy regardless of the health of the mother. So just know that it's not a test telling you how good or bad you are or how good or bad you're doing. It's just a test that we need to conduct on every pregnant person. The test is conducted typically between 24 to 28 weeks pregnant, and your doctor will schedule that with you. The process for the test is pretty simple. Typically, it's done in your doctor's office, but it could be done in a third-party location, such as like Quest or LabCorp. The process is that you drink a drink called glucola. It contains about 50 grams of sugar. You will need to drink it within a certain time frame. Usually it's 5 minutes, maybe 10. And then your blood will be drawn an hour after you consume the drink. Different doctors will use different ranges for how they want to go forward based on your test results. But typically, if you test higher than 140 milligrams per deciliter, but less than 190, then you're going to have to go on to do another test, which is the 3-hour oral glucose test. If your results come back higher than 190, they likely won't make you do the 3-hour test, and instead they will just diagnose you with gestational diabetes. Remember that your doctor might use different cutoffs, and be sure to discuss the results of your test with them if you have any questions. The 3-hour test is a similar process to the 1-hour test. The difference is you're going to be in the office a lot longer. You're going to be there over the course of 3 hours, and you will start off drinking a drink that instead of 50 grams of sugar, it will have 100. So it's a lot more, and it can be a little bit hard to drink that in such a short time period. If you're doing the 3-hour test, your blood's going to be drawn 4 times over the course of your time at the doctor's office or testing center. They'll draw it as soon as you get there, after 1 hour, after 2 hours, and then again after 3 hours, and then you will be done. The results of the 3-hour test will determine whether or not you're diagnosed with gestational diabetes if the 1-hour test called this into question. Some doctors are now offering taking an A1C test at the beginning of your pregnancy. So this would just be a typical blood test where they're testing your blood sugar for the past 3 months, and that can be done in the first trimester. And if you have any concerns about taking the 1-hour test or about potentially having gestational diabetes, if you feel that you are at higher risk, you can ask your doctor if you can do the A1C test early on in pregnancy instead of waiting for the 1-hour test. So if you're already past your first trimester, you can't do the A1C, and you don't want to drink the glucola because maybe you have a sensitive stomach or you've had issues with it in past pregnancies. Some women, it will make them vomit. So if you, maybe this is your second or third pregnancy and you do vomit the first time and you don't want to do that test again, there are alternatives to drinking the glucola and doing the 1-hour test. And you can discuss those options with your doctor because it may be specific to that doctor.